Okay, so we're here with Nurse Megan, nurse anesthetist. I'm just going to ask you a few questions.
Sounds good.
What was your path or journey like to become a CRNA?
So I knew I wanted to do CRNA, at least I knew I wanted to do nursing, but I was suspected that I wanted to do CRNA from when I was in high school. So I went to a bachelor's undergraduate 4-year nursing program in Philadelphia at the University of Pennsylvania after high school, and then there's a working requirement of at least 1 year for the program I was applying to. So I worked in Dallas in an ICU for 2.5 years about, and then I came back to the University of Pennsylvania and did a 2-year master's program for CRNA.
What made you decide to become a CRNA?
I actually babysat for a lady that was a CRNA, and her sister was also a CRNA, and her sister's husband was a CRNA when I was in high school, and so I shadowed them before I decided to go to nursing school, and I loved the technical part of it, and I loved that they followed the patient all the way from the beginning of the surgery to the end of the surgery, so they really got to spend at least some time with their patients.
What does a typical week look like for you?
It kind of depends on where you work. Here, the medical group that I work for, we have either a 4-day or a 5-day-a-week schedule, and I'm a 4-day-a-week employee, so I work usually 2 10-hour shifts and 2 12-hour shifts. My day off kind of moves around, but it's nice to have that extra day. Yeah.
How do you balance your personal and work life?
It's hard to not take work home, and that's not just as a CRNA, but as any type of nurse. It's hard to not think about like, oh, did I do this right, or did I make a good decision here, or did I help that person the way I wanted to. But I think definitely with time it gets easier and easier. I really like to read, so I like having that free time to read what I want, as opposed to going home and studying and all that kind of stuff. So it really is, once you graduate, a load off. You have more free time. So then it just becomes like learning to leave work at work and kind of focus on your home life when you're home.
What are your plans for the future as a CRNA?
Right now, I love my job here. I like working 4 days a week. I like the anesthesiologists that I work with. I like knowing that I have a team that can help me. I like knowing that I have people that back me up. That's why I like working in a care team model. I think maybe eventually I will work independently, whether it's at a surgery center or maybe an endoscopy or something like that. But I feel like right now I really like the more complex cases that you do when you're working within the team atmosphere, and so I think I'll stay where I am for now.
Well, I appreciate it. That's all the questions I have for you.
No problem.
Thank you for your time.
Yeah.